Hi everyone, thank you for joining us for this next webinar in our MPS reform series, and sincere apologies for the need to delay this due to our building evacuation last time, but we're really pleased that you can join us today. So my name is Kathy Milful, and I'm still Acting Assistant Secretary of the Thin Markets Branch, which has responsibility for the MPS program. So I'll be hosting today's webinar. It's great to hear from you again. I'm also pleased to introduce Catherine Kawasaki, who's on screen as well, who'll be joining me. Catherine's from the Aged Care Assessment Policy section, and she'll be with me on the panel today. So just a bit of housekeeping first. As per the last webinar, today will include a formal presentation as well as a Q&A session at the end. So you can submit questions and answers like last time in the Q&A panel on your right in Teams. And we'd really encourage you to do that throughout the presentation today to make sure today is as useful, as interactive as possible for you. You don't need to wait till the end. You can do that anytime, and then we'll try and get to as many questions as we can during the Q&A session. So I think that's pretty much it for the housekeeping today. So I'll get my team to bring up the slides for today's presentation and we'll get started. But just before I do, I of course wanted to acknowledge the traditional owners of the lands on which we are all meeting today across Australia. I would like to pay my respects to elders past, present and emerging. And I also want to extend that respect to any Aboriginal and Torres Strait Islander peoples here with us today. So let's get started. So this slide outlines what we're going to cover for you today. I did want to start off by saying there is going to be quite a lot of information to go through today, as it's been quite a a big few weeks for aged care, as I'm sure you're aware of. So apologies if the webinar is a little bit more dense today, but we are going to try and summarise some key takeaways for you where we can. So as per this slide, the first section of the webinar, we're really going to focus on some of the recent aged care announcements by the government. I'm then going to provide you with some key reminders about eligibility and assessment arrangements under the new Act. So what happens for new entrants to an MPS after the new Act commences. I'll then hand over to Catherine, who's going to take you through some information about an important new project called the Assessment Experience Project, which is related to that eligibility and assessment space. And finally, then we will talk through transitional arrangements for the new Act, followed by a few quick reform updates and reminders, and then we'll start the Q&A session. All right, so just quickly, this slide just gives you a bit of a notice of future webinar topics. Obviously, sorry, we've now shifted these back a month due to this webinar being delayed. So as you'd be aware, up until now, we've really been focusing on matters of how MPS providers will be regulated under the new Act. This webinar today really moves on to focus much more on MPS clients and impacts on client pathways and requirements under the new Act. And then next month, we really want to turn our attention to funding under the MPS program, including how subsidies work under the new Act, as well as client fees and payments. But just wanted to flag, we will keep updating this slide and our schedule to reflect consultations that are happening with the new Act, so that as much as possible we can engage with you where you've actually been given an opportunity to comment on something and have the information to do so. As always too, we always welcome your suggestions about future webinar topics, so feel free to send these through to my team. All right, so we will start off with the main topic for today. So I guess the really exciting news is that the bill for the new Aged Care Act was finally introduced to Parliament on the 12th of September 2024, so it's quite a hefty document, as you can see. The bill has not yet been passed, as I note has incorrectly been reported in a few places, but importantly, it's before the Parliament, so it's beginning its parliamentary journey, which is still an important and really massive milestone for aged care. As noted here on the slide, if passed, not only will the new Act address about 60 outstanding recommendations of the Royal Commission, but it also responds to the more recent recommendations of the Aged Care Task Force. I just want to say there's probably been a lot of focus you've seen in the media since the 12th on changes to client contributions for aged care services in response to the recommendations of the task force, which probably is not so relevant to MPS. But I think it's also important to recognise that the bill will be the start of building a new rights-based aged care system that places older people who need care at its centre. It really aims to improve transparency, accountability, and the way services are delivered to older people. So, what has changed in the bill since the exposure draft? Look, I won't go into this slide in detail, and some of you might have already seen it if you've dialed into one of the new ACT webinars, but it really was just for your reference in case you're wondering what changed since the exposure draft in the bill, which was published back in December, and the actual bill that's been introduced to Parliament. So just quickly, really the differences are that, you know, the missing chapters have now been included, obviously. So in particular, you'll note the additional chapter on the funding of aged care services. So that's chapter 4. But there have also been a couple of changes in response to feedback from the exposure draft. So for example, as noted here, the bill's been changed to include a positive requirement for providers to uphold the rights of older people. Criminal penalties for breaches of new statutory duties, which had raised some significant concerns for the sector, have also been removed. So, where can you find more information? Well, I just wanted to flag there's actually a lot of information out there already on the bill. And so we will make sure you get copies of this presentation where I've put links into relevant documents, but my team will probably also try and post some links in the Q&A as I go today for those eager beavers who are keen to have a look straight away. But yeah, there is a lot out there, but I appreciate, look, it can be a bit hard to access, like to digest, where there's a lot of information out there. So we really encourage you to sing out if you've got questions on how something impacts MPS specifically. We can take your questions into account as well when we're progressing future webinars. Or as you all know, we now have like an MPS reforms webpage. So we're really happy to put sort of more tailored information on that page if we're noticing there's some really common questions coming through from providers or jurisdictions. So next up, I just really wanted to flag that obviously the government, you might have seen the Prime Minister announced that the bill had been introduced, but alongside that, I think it's important to recognise that the government also announced a $5.6 billion aged care reform package. So that includes the funding reforms I've mentioned, but also support at home, which is also targeted to start on 1 July 2025. So through these webinars, we're obviously trying to focus on things that really impact MPS providers specifically. But of course, if there are other, things that you'd like to know about in the broader reform package, please give us that feedback and we can weave it into these webinars as well. But in terms of thin market measures, so there were actually some measures included in that reform package, which were specifically relevant to the delivery of rural and remote aged care and indeed to MPS. So I've listed a few on these slides just so for your awareness. So they include that an additional $300 million in infrastructure funding was committed to by the government. So that will come through our ACAP program, the Aged Care Capital Assistance Program, and it will mean that there'll be the potential for more or expanded opportunities for grant funding for infrastructure upgrades. Consistent with the recommendations of the Aged Care Task Force, the department will also be reviewing the remoteness classification system for aged care, which you often hear people talk about as the Triple M review. So as part of this process, which you'll hear more about, we really welcome your feedback regarding any identified issues with the classification for your region. I think it's important to recognise too that that review is not going to be done in isolation. We'll also be doing a stock take of other rural and remote policy levers and developments, as well as looking at how this works across the broader care sector. Another inclusion in the reform package was that the Independent Health and Aged Care Pricing Authority, or HIHACPA, will be undertaking an assessment of how the MPS program is funded. This group's probably aware that that's been on the cards for quite a long time, but that's now been officially announced as well. And it's important as this specialist advice will then inform the work of the department, who will develop a new MPS funding model addressing outstanding parts of recommendation 55 of the Royal Commission. So we'll give you more details about all these projects in the coming weeks, and particularly as scoping discussions move forward and we can confirm, you know, things about timeframes and when consultation, etc., will occur. All right, so what's next with the new Act? So just to clarify that the bill has been referred to the Senate Committee Affairs Legislation Committee, as you might be aware. Some of your jurisdictions may already have provided a submission, and that there's planning to be a report by the committee by the end of October. I just wanted to flag here that during this time, the department will be inviting feedback on some of the rules that sit under this law, and indeed that's already started to happen, and that's one of the things we wanted to talk to you about today. This consultation on the rules will then help inform a parliamentary debate on the bill. It's also a really important process because, as you might know, the rules contain the details that's really important that we get right to ensure effective implementation of the new arrangements. So we're really keen for you guys to get involved in this process and any feedback opportunities that arise, which we will highlight through these webinars and our regular communications with providers and the jurisdictions. All right, so speaking of the rules, some of you might be aware that the first set of draft rules has actually been published for consultation. So that's available on the department's website, and those rules cover what's called the aged care services list, which you would have heard me talk about before. So this is a really important pillar of the new aged care system. So this list will list all the aged care services for which funding will be payable to providers under the new Act. And importantly, that includes the MPS program. So I'm not sure if anyone's had a look yet, but it is quite a long, lengthy and complex list because it really is one list to cover the whole aged care system. But essentially, if you have a look, you'll see a list of services that are grouped into service types and also service groups. If your MPS only delivers residential care, it's the residential care services group that will be of relevance to you, with providers, as in the current world, expected to deliver all the services within this group as needed by the residents in your care. If your MPS delivers services out in the home or community, then the other services will also be relevant. Okay, so what do we need from you? I guess, look, I'm keen for everyone to have a look at the draft service list. Check the list. If there's anything you think is obviously missing, we're obviously keen to know. Or if you have any concerns about how the services are described, and you'll note in some places there's identified exclusions, so things that are not taken to be part of that service. So if you think there's anything that's at odds with how your MPS or your jurisdiction currently operates, it'd be great if you could provide us that feedback. I did want to mention though, just that on the service list, there is a lot of sort of complex language around means testing categories, things like efficient prices, unit prices, loading type. Please don't worry about all that because they're not actually relevant to MPS. That is more relevant to the new Support at Home program. So from an MPS perspective, if you can just consider the services, their description, and those exclusions, that would be great. All right. So that's the service list, which, just to reiterate, is already out for comment in October. We don't actually have the full consultation schedule finalised for the rules, but that is underway. But I did just want to flag that the next up, we expect that you will be able to take a look at the sections of the rules that relate to subsidies, fees and payments. So we're going to discuss this in detail at the next webinar and welcome your further feedback. But just in case you see these in the interim, I just wanted to flag not to worry too much, I think, about the subsidy rules, given that they're not expected to change much from the current arrangements. Effectively, they're very similar to the current world. They're just put in the language of the new Act. On the other hand, there will be some changes in terms of the fees and payments arrangements consistent with the Aged Care Task Force report. So we'll talk about those at the next webinar, but just be aware that we are expecting to make some changes, and that's really to ensure that client fees for MPS do not exceed the limits that are imposed on mainstream aged care programs, and that MPS providers who choose to charge accommodation payments as currently are required to meet standard requirements for these under the legislative framework. So in terms of the new Act and the next steps, just some key takeaways here, as that was probably a lot to take in. So the main things to remember is the bill is before Parliament. It's subject to parliamentary passage, but the aim is still at this stage to commence on 1 July 2025, subject to parliamentary passage. The rules that sit under this bill have started to be released for consultation, and we'll discuss more of those rules as these webinars continue and as they're released for consultation. All right, thanks everyone. So the next topic, we're really looking at who will be able to access Commonwealth funded aged care services. So we're moving on to questions of access and eligibility. So this slide you would have seen before is just a reminder of what we call the single entry arrangements that come into place with the new Act. So what this means is that older people seeking Commonwealth funded aged care services basically need to make an application. They're going to then have their eligibility to proceed to an assessment determined by the delegate. If eligible, they will then undergo an individual needs assessment with an approved needs assessor. The needs assessor will then make recommendations to a delegate who will make a legal decision on whether the person requires aged care services and what type of services they can access. This delegate may also make additional decisions, including, for example, the level of services the person requires, or the funding that they require, and their priority. So what is the urgency in terms of them assessing those services? So what does this then mean for MPS? So just to summarise, because it can be a lot to take in short, what we're saying is that those arrangements that I just discussed will also apply to the MPS program. So that is different to the current Act. Subject to what will be known as the alternative entry arrangements, which I'll talk about more in a second. To commence care via an MPS, after the new Act commences, an individual will need to go through those same single entry arrangements that I just discussed. MPS funding will also need to be used to deliver services to individuals consistent with their approval decision from the department. So that's services that are on the service list that we just talked about. Those other decisions, though, that a delegate might make around funding levels and priorities don't actually have any relevance for MPS, and that's because of our block funded arrangements. So you don't need to worry about that, but you will need to be cognizant of what services the person has been approved for to access. So, are there any exceptions to this? So I think the main thing to note here is there will be transitional arrangements in place for individuals that are already accessing services through your MPS, and we'll talk more about those shortly. But there are also these alternative entry arrangements that I wanted to flag with you because we have talked about them previously, but they weren't in the exposure draft for the bill. So you'll now find them in section 71 of the bill if you want to take a look. And effectively, they are the mechanism through which we allow an individual to enter care immediately in certain circumstances, with the application and assessment process we have just discussed to occur retrospectively. So to be clear, they still need to go through that process, but it can happen later. When this occurs, the older person will still need to make an application, and at the moment they'll need to do that within 5 days of you commencing service delivery, unless we decide we actually need a longer period for MPS, and we can actually prescribe that in the rules. So as per the slide here, we'd really welcome feedback from providers and jurisdictions, whether you think that 5 days is practical for MPS, or because some of the challenges in an MPS or in a rural and remote environment, you think a longer time frame would just be more appropriate for MPS. So please let us know if that happens. All right, so I think I will give you a break for my voice for a second. Thank you very much for listening so far. And I'm going to hand over to Catherine, who's going to talk to you about the assessment experience project.
Thank you so much, Kathy. And thanks for your time today. It's lovely to meet you all and to provide a break for Kathy from speaking for most of the webinar, as I've discovered seems to be her want. As Kathy mentioned earlier, I'm the policy lead in the aged care assessment branch here at the department, and I've come to talk to you about one of the projects we're undertaking at the moment, which is future focused. It's called the Assessment Experience Project. What we're doing is really thinking about what the experience will look like for clients and assessors after the new Act and Support at Home are introduced, so that we get it right. So what we're looking at is developing a clearer picture of the future state assessment process. And one of the things we want to do through that is to identify gaps and issues in the future state assessment experience. And we're also keen to develop some tools through this project to help us evaluate the impacts of future proposed changes to the assessment process. So even, further ahead, not just when the new Aged Care Act and Support at Home are introduced. So we're looking forward in that sense. In terms of how we're undertaking the project, we've got 2 phases, and we've just completed phase 1. So through phase 1, what we're trying to do is get a high-level view of the future state through getting a journey map that identifies the key touch points for clients and for assessors, and then look up and investigate some key risks and considerations in phase 2. So identify what we're going to focus on. And the way that we're doing it is through a mixture of bringing together existing resources and also targeted engagement. So that's been happening, and we've just pretty much finished phase 1. Phase 2 of the project is, can we go back to the previous slide? Sorry. That's okay. Phase 2 is us getting up close and looking in detail at some of the things that we've identified through phase 1. And that's where we're hoping to get some of that really targeted, detailed mapping, some cohort profiles, scenarios, and some resources to help us to evaluate the impact of particular changes to the assessment process in the future. So really useful, tangible things that we can use in the department on a day-to-day basis to help us think about, oh, this change is going to happen to the assessment process. What will that mean? And so if you look to the right of this slide, some of the project outcomes we're looking for is to understand the cognitive load, emotional journey, and time taken for clients and assessors, and how that might change through some of the introduced changes to through the Act and whatnot, to identify and prioritise risks and gaps, to identify risks in the transition to future state, and to help us evaluate requests. And one of the other things we're trying to do is use the knowledge we're gleaning from this project as we go to support the change management, because we're really conscious that there's so much change happening in the assessment space at the moment. Okay, I'm ready for the next slide. Thank you. And so we thought we would share with you an example of the high level, so the phase 1 high level journey map. It's a work in progress live document. So this is literally a screenshot of it that the team took as we prepared for the ill-fated session that got cancelled due to the evacuation the other week. And so I suppose one of the things that I'm interested in today is any particular concerns or questions that you might have about the assessment experience for clients or assessors under the MPS, thinking about the future. And we know that there are unique challenges in rural and remote areas. So please, if you do have any comments or questions, pop them into the chat, but obviously also happy to talk in the Q&A. But now that Kathy's had a break and I've talked about the Assessment Experience Project, I'll hand back to her for the final section of the webinar.
Thanks, Catherine. And yeah, everyone, I do encourage you to get those questions in while we've got Catherine with us, because, you know, the bill and the Act is one thing, but we're very conscious that it's not all about the legislation. It's really important that the practical process works and works well. So we really can't emphasize enough, I think, that we want to hear from you. You will understand where those pain points are and what we can do to address it. So feel free to jump in or reach out to us separately as well. So moving on, I just wanted to talk more about transitional arrangements. So up until now, what Catherine and I have really been talking about is what happens with new clients who commence with MPS, but also we need to talk about existing clients. So what happens to individuals who are already in your MPS, for example, when the new Act starts. So a separate bill is being drafted, which will allow us to make special transitional arrangements for existing clients and providers where we need to. Up until now, we've been talking quite a bit about providers with the group in terms of deeming arrangements and what's going to happen to make sure you as an existing MPS provider can be deemed over to be a registered provider on 1 July 2025. And now that the bill is introduced, we will be progressing those discussions with providers. But today the focus is really on older people themselves, so the people in your service. We really need to now work with you all to manage the care of these people when the Act commences and make sure there's no issues. You know, we want continuity of service for those individuals. So as per this slide, you know, there are a bit of challenges, particular challenges here for MPS. So that's why we're really keen to start these discussions with you and make sure that we are able to identify the individuals in your care and the services they are accessing. We will then need to make sure that those people meet any legal requirements for transition over under the new Act, and that those people have their position under the new Act documented and explained to them. So there's quite a lot of work to do in terms of identifying these transitional cohorts. So we'll be commencing preparations to engage with each of the jurisdictions to confirm the most efficient approach for doing this. And we've already started these discussions at a high level with the MPS working group. But we're really keen to get moving on this now, so there's not a last minute rush in 2025, or worse, older people are somehow negatively affected. So we really need your help to identify the relevant individuals and get their details recorded in our aged care systems. So, as I mentioned earlier, we also need to get your help to ensure any transitional requirements are met. I would really like to say that I have all the details of these already, but I don't, as the bill is still being drafted, and the transitional bill will also have rules that sit under that bill. But we really don't want to wait any longer with this to progress discussions, and we really want to work with providers and jurisdictions to identify any hurdles early. As noted on this slide, it's also expected that there's going to be different requirements that need to be met by individuals who we want to continue to access residential care in an MPS, as opposed to those individuals in your communities that you might be providing services to in their home or in the community. So, what are we likely to need to know? So this is a bit of a complex slide, but just in short, you can see it's split on the one hand into residential care services and the other home or community. So if you have a person that's in residential care, while this is still being worked out, as I mentioned, what we think we're going to need to know is we're going to need to be able to identify who the person is. We're going to want to know, are they accessing respite or permanent residential care in your MPS? We think we're going to need you to confirm that the person has some kind of infirmity, illness, disease, incapacity, or disability. And we're going to want you to advise us on what information your assessment is based. For example, have they had an ACAT? Did a GP complete an assessment? Or is there medical information available on their file? Look, I've got to say we're still confirming what level of information and or evidence will actually be required from a legal perspective, and we suspect it might be different for individuals who had an ACAT already and those who haven't. But we're keen to share with you now as much as we can early on and to get your thoughts and ideas if there's a problem. Our aim is certainly to avoid people requiring a further new IAT assessment where possible, though we do note that after the Act commences, if someone then moves from an MPS to, for example, a mainstream residential care service, they may need further assessments. So that's residential care. On the home care side, there will be similar processes in place, but we will probably need slightly different information from you, including the reasons why the person requires aged care services, but this is still being confirmed. But you can see on the slide there, it gives you an example that we'd want some kind of advice from you that you're providing services that support the person to live in the community and prevent their isolation and keep them, at home and not in residential care or a hospital. So that's where we're at the moment. So things to remember, I think, it's just important to remember that July 2025 is the starting point for all this. The transitional arrangements are really about ensuring we don't disrupt services for existing MPS clients where possible. But to do this, we're going to need your data and we're going to need your help. So we would really encourage you to start reviewing what client records you have for your MPS clients and whether you're in a position to provide these to us. For individuals that have never been recorded ever in the Commonwealth aged care systems at all, for example, because they've never done an ACAT, we would also really encourage you to at least get their details recorded in My Aged Care as a first step. We will then come back to you with more details about what level of information we require and any additional processes required to transition them over, as obviously we don't want you put you all to extra effort for things we don't need. So please don't worry, we will confirm exactly what's required. All right, so I think that's the Act for now and transitionals. Moving on just to the last topic of the day, just before we move to Q&A. So we just wanted to give you a bit of a few small updates. So firstly, here we've got our usual schedule of MPS reforms on the screen at the moment. Look, this really hasn't changed, but you can see we're now in that October space, and that's with the MPS allocation round. But apart from that, no changes at the moment, but just please be aware now that the bill has been introduced, we'll continue to monitor the timeframes that are listed here for each of the projects and what makes sense depending on when the new Act passes and is implemented. All right, so just a couple of other quick updates. In terms of the 24/7 and direct care trials, so that's one of the reforms too that we're keeping an eye out in terms of timeframes. You can see here that my team have been out visiting participating sites, and we really thank all the sites for their participation in the trial so far, and for the welcoming my team and their open approach to discussing the issues with them. I know they've found it really helpful so far. So we've had the first 24/7 reporting period now completed, and so far the arrangements seem to be working well, but that's something that we will be discussing at the first proposed reform implementation sub-working group, which is being now scheduled for late October. So at that meeting, we'll also discuss the findings from those site visits and also recent surveys that participating sites have submitted to us to give their feedback on, not just, for example, on 24/7, but how they've found the reporting process and any ideas or suggestions for improvement. All right, so just a couple of extra updates here. I mentioned the MPS allocations round, so just a reminder that that's open at the moment with applications closing on the 25th of October. So that's really the mechanism via which your MPS can get additional residential care places. The second ACAP round has also now closed, and just for your information, we're hoping decisions will be made before the end of, sorry, that should just be the calendar year, hopefully, definitely, I think in December. And just a reminder that what we know as Rural App or the Rural Locum Assistant Program has also been extended up until 30 June 2025. So just a reminder that, this program is available to assist with locum support where you've got, staff needing to leave your MPS to do professional development or there's high staff turnover. So it's available for a range of positions, as we've noted there, and there's also funding available for relocation and retention incentive payments. So just flagging that because my team did note when they're travelling around to various sites recently that some providers didn't seem to be aware of this program. So please let us know if you need more information, but it is really there to help rural and remote providers, where they've got, staffing challenges. So please do make yourself available to that program where you're eligible to do so. All right, lastly, just a final reminder before we go really to the Q&A session. Just wanted to say, don't forget that there are requirements for managing and preventing incidents that we know as SIRS, which do apply to MPS providers when delivering home or residential care services. So this includes reporting, what's known as reportable incidents, and specific obligations, particularly under the quality of care principles. So you need to have an incident management system in place. You need to use this data to drive quality improvement, and there's certain incidents that you need to notify the Aged Care Quality and Safety Commissioner or Commission of. So look, I'm not going to go into too much detail here. There's lots of resources on the Commission's website, and I understand they are actually going to look out to reach out to providers soon just to give you some more information. And that was really just because some providers seem to be unaware of these responsibilities recently, so we want to make sure that everybody's on the same page regarding their obligations here, particularly because these obligations will continue to apply under the new Aged Care Act. So if you do need any extra assistance, training or explanation, including around the use of restrictive practices, it would be, I think, really useful to address that as soon as you can, and reach out for additional assistance if you need it prior to the new act coming into place. So I think that's really it from me, team, but it looks like I've either stunned everyone into silence or they're feeling shy today. So I don't think we have any additional questions. Just checking with my team. I think someone asked, we definitely will share the slides, so don't worry about that. And the team have put in lots of links in the Q&A as well. Okay, well, I might say going, gone all, no questions. So hopefully that all was really clear for you, but please feel free to reach out. As I said, if you've got any other questions, happy to give you a buzz. We really welcome your participation today. And Catherine, I really wanted to say thank you to you as well for coming along. We really appreciate your time. But if that's it for everyone, we'll leave it there. And we'll see you next time for the November webinar. Thanks, everyone. Take care. Bye.